So some of the, I guess, more effective policies and practices that have been implemented by law enforcement throughout the world include policies where police agree to not patrol or not target the distribution of needles and syringes, whether that's through drop-in centres, whether it's through needle and syringe programs or outreach workers. We know that if police do target those programs, that many injecting drug users will not be able to get a supply of clean needles and syringes. They will share needles and syringes, and therefore bloodborne viruses will be easily transmitted. We also need to look at policies and programs implemented by police that support naloxone, which is the opiate or heroin overdose reversing drug. Many law enforcement officials are now carrying those substances such as naloxone to reverse overdoses, and it's been shown to be quite successful, particularly in the United States, where law enforcement agencies are carrying naloxone to reverse opiate overdoses. We also have good examples of law enforcement approaches towards overdose where they have implemented policies where they do not attend an overdose, which I guess gives confidence to people who are at an overdose scene that the police aren't going to turn up and start arresting people. That would be a deterrent for people calling an ambulance, for example, when an overdose occurs. So police not attending overdoses, police supporting naloxone by carrying naloxone, and not targeting needle and syringe programs to arrest people are good examples of how police can reduce risks for people who use drugs. There's also some other good examples of how law enforcement can support the reduction of drug-related harm, particularly disseminating information about harmful drugs, harmful substances. For example, many substances such as ecstasy, other party drugs, social, recreational drugs, which are manufactured in an illicit or illegal environment. The ingredients or the substances that are often mixed with those drugs can be contaminated, they can be risky, and they can often be very dangerous and deadly. So many law enforcement agencies now are introducing warning systems where they receive information and analyse drugs that indicates drugs can be harmful and send that information out to drug-using groups and other venues such as nightclubs, dance parties, music festivals, saying to people who use drugs in those environments, look, there's a risky drug out there, this is what it looks like, you need to be mindful, we suggest strongly that you don't use that drug. Another good example of how law enforcement can support programs that reduce drug-related harms is to implement drug diversion programs. One of those programs that has been introduced in the United States is called law enforcement assisted diversion. That's where police find someone who is a low-level drug user, and sometimes even people who are trafficking and using drugs, trafficking to support their drug use. So if a police officer finds someone who is a drug user and that police officer I guess makes a decision or determines that that person should go into treatment or that treatment option is offered, rather than going to court, the law enforcement officer can divert that person through to assessment and treatment. It also works for other programs where a person may be homeless or experiencing mental health issues or family violence. So I guess in that situation, whilst some of those issues may be criminal in nature, the law enforcement officers have an option, particularly with people who may find it very difficult to get into treatment, for example, drug treatment. The police officer can directly divert that person into a program where they can go into assessment and treatment straight away. So getting that person into treatment really will help that person in terms of dealing with their drug use. So it's an option there for police rather than sending someone, for example, to a court situation where they may end up in jail. And we certainly don't want people who use drugs in jail. There are other good examples of police reducing drug-related harm, for example, caring for people who may find themselves in custody and they are drug affected. So if a person's affected by alcohol and drugs, there are programs where police now introduce a nursing and medical system into custody centres, into custody suites, into watch houses, into police lockups where people who are affected by drugs can get medical attention from professionals such as health, nurses and doctors. So that's another example of reducing drug-related harm. I know also too, in terms of the spread of HIV and also reducing injecting drug use, that many law enforcement agencies now support methadone programs, and that includes the provision of methadone whilst people are in custody and also in prison settings, but also diverting people through to methadone programs. There are obviously benefits for law enforcement in that they can reduce injecting and therefore reduce the risk of bloodborne viruses, but there's also some very good evidence that people who go into a methadone program also reduce their other criminal behaviour to feed their habit around particularly acquisitive crime, burglary, theft, stealing, to get the funds to buy heroin. So if you can get a person into methadone and get them off heroin, then there's a good chance that they will reduce their other criminal behaviour as well, which is a good outcome for police. There's also some really good examples of police supporting programs such as supervised injecting facilities. For example, in Australia, there's an injecting facility in Sydney. There's legislation there that provides, I guess, some indications or some guidelines for police around not arresting people who are travelling to the injecting facility with a small amount of a drug who are genuinely going to use an injecting room. So most people would know what an injecting room is. So those programs have been set up in a number of countries throughout the world, and police support them. But from my own experience in Australia, police support the one that's in Sydney, and they do that by not prosecuting people who are found with drugs who are going to use that injecting room. So, and finally, I guess there's a good example from Southeast Asia where there's a significant issue around HIV. And that is about the possession of condoms, particularly condoms by sex workers. And I know in the past in some countries that possession of condoms by sex workers has been used as evidence of sex work. But I know in a number of countries, for example, Malaysia, police have now introduced policies that they don't use condoms as evidence of sex work. Obviously, we want condoms to be just distributed and used by sex workers. We know that many sex workers have clients who are married men, so therefore the risk, to the general community, in fact to anybody, obviously, if they don't use a condom in terms of HIV transmission is quite real. So police not seizing condoms as evidence of sex work is another example of how police can be supportive of health outcomes. So I hope that's a benefit. I hope that that's clarifying the police role, and I thank you very much.